My name is Libby, and I'm addicted to Kegels. It all started when I was pregnant, and I wanted to strengthen my pelvic muscles so that they can stretch during the birth. And now, I just can't stop.
Fetal heart rate, baseline 120 with minimal variability.
Of course I'm pregnant. I can feel my baby moving around in my womb.
This presumptive sign of pregnancy is called quickening.
What do you plan on doing with that thing?
I'm gonna artificially rupture your membrane.
You're gonna what?
Break your water.
I'm sorry, what?
Snag your bag.
After that, check the fetal heart rate for distress.
I'm feeling around for a movable part in the fundus and a long, smooth surface on the right side. Where would I look for the fetal heart rate?
Something's not right here. Much better. APGAR at 1 and 5 minutes.
It's been 1 minute since birth. Time to do the APGAR. Skin color is good with bluish to hands and feet. Heart rate 132. His cry. How's his muscle tone?
APGAR score 9. No accelerations. 2 decelerations with fetal movement. Interpretation, non-reactive, non-stress test.
Your water is broken, but now you have a fever. What should I do?
I got this.
Sniff the pad for foul odor.
Oh boy, I'm preterm, but I think little Nikki's coming early.
Whoa, looks like that baby wants out.
Yeah.
I need to give you some terbutaline to weaken those contractions. And if that doesn't work, I'm going to give you some betamethasone, and that's going to mature in Nikki's lungs.
Yeah, just drug me up. Do what you gotta do.
I can't wait till this thing falls off. Then you can have a tubby. Yay!
Hi, nurse. My last menses was about 7 weeks ago, and now I got this unilateral stabbing pain over here. What's wrong?
Oh, we better get you checked out. I suspect an ectopic pregnancy.
Measuring head and chest circumference. Measure around the forehead. Measure at the nipple line.
Oh, gosh. This heartburn. I'm only 12 weeks pregnant, though. Does this mean my baby's gonna have a lot of hair?
Well, actually, it's because of the increased progesterone production that's causing decreased motility of your smooth muscle.
Vitamin K is given within an hour of birth.
Time for your vitamin K.
Wow, my nipples are sore.
You should express some breast milk and rub it on your nipples.
And then air dry them.
Wow, my breasts are engorged.
Alpha fetal protein test.
All right, now that you're nearing 15 weeks, you should get a maternal serum alpha fetoprotein screening done.
Maternal alpha what?
It's a screening test to see for spinal defects.
Reflexes that facilitate breastfeeding. Rooting reflex.
I'm only 12 weeks pregnant, but my uterus, gosh, I feel like I'm way further along than that.
Well, we better get you checked out. I suspect a molar pregnancy.
Trisomy 21. Down syndrome. Common characteristics. Protruding tongue. Transverse palmar creases.
Man. Uh-oh. It's breech.
What's he reading the New York Times in there?
Oh no, your fundus is soft and to the right. Someone needs to go pee-pee. You've emptied your bladder and your fundus is midline, but it's still boggy. Massaging it isn't helping.
Give her some Methergin.
Okay.
Wait, don't forget to check the blood pressure first. If it's high, don't give it.
Okay.
Fundus firm.
So my panties are soaked in bright red blood? What's wrong?
It may be a placenta previa. We should order an ultrasound stat.
But it doesn't hurt.
Yes, but the ultrasound is needed so that we can confirm the location of your placenta.
Well, if you gotta do it, go ahead.
I'm just starting my shift. Who should I see first?
My blood pressure is slightly high, but I've been stable for 2 days.
I need help ordering tacos for dinner.
I need help with breastfeeding.
I had a C-section this morning and I'm having 8 out of 10 pain.
I think I should see the one with pain.
Oh my god, my fingers and my lips. They're so tingly. What's wrong?
I have your ROGAM.
What's ROGAM for?
Well, since you're Rh negative and your baby was Rh positive, this will prevent your body from creating antibodies against the Rh antigen.
Yes. Greetings. It is I, the Count, and it's time to answer that fascinating question. What is the Sesame Street number of the day?
If I'm breastfeeding my baby, how do I know if they're getting enough milk?
Count the wet diapers. 1, 2, 3, 6 to 8 wet diapers a day.
I got the diabetes. Is there anything I need to worry about for my baby?
Our priority will be watching for signs and symptoms of hypoglycemia.
I wish my baby had more hair. I guess I'll cover it up.
Yay!
Postpartum day 3.
Fundus firm, down 3.
Breast hard and warm.
Moderate lochia rubra.
Is this normal?
I have gestational hypertension. I need my admitting vitals taken.
I have a red splotch on my breast.
I just came from labor and delivery and my pad needs to be changed. I need someone to look at my bleeding.
I'm 2 days postpartum with a 4th degree laceration. I need someone to bring me a sitz bath.
I wonder which of these patients I can have my assistive personnel help me with.
Duck, goose. I can help you with that sitz bath, sweetie.
I had my baby a week ago, but now I have this painful redness on my calf.
Elevate the leg. My patient just got admitted with preeclampsia. Which signs and symptoms are inconsistent with this diagnosis?
3+ protein in the urine?
Pitting sacral edema.
Elevated blood pressure.
Deep tendon reflex of +1.
Oh my gosh, it's little Nikki. Grandma's gonna come take you from the nursery.
How about mom calls and I'll bring the baby down to her?
I'm about to start magnesium sulfate, so checking the respiration rate is going to be the priority assessment. Well, I've started the magnesium sulfate, and the respiratory rate has decreased, and reflexes are absent. What should I do?
Stop the mag.
Man, I'm having these contractions. I'm not sure if I'm in labor, though. Is there any way I can tell?
There's only one way to find out.
Remember, true labor changes the cervix. A biophysical profile includes which elements?
Fetal neck translucency?
Fetal movement?
Fetal breathing?
Fetal gender?
Amniotic fluid volume?
I'm having a non-stress test, and my baby hasn't moved. I hope little Nikki's all right.
Here, have some orange juice and crackers. See if that helps.
GT-PAL.
Okay, and why don't you tell me about your OB history?
All right, well, I gave birth to my first son at 40 weeks. I gave birth to my daughter at 34 weeks. I did have 2 miscarriages in between, though. And now I've got my 3rd child on the way.
I'm hepatitis B positive.
And I'm her baby. I need 2 shots.
And that's all you need to know about bottle feeding your baby.
Okay, so I tip the nip so there's air in there while my baby sucks?
Let's go over this one more time.
Oh my God. Little Nikki, you're killing me. Anything for this pain.
Would you like me to apply the gate control theory of pain?
Yes, anything. Please. Oh, yeah. Oh, this is fun.
So now that I've given the epidural, you'll be at an increased risk for decreased blood pressure.
Oh, whoa, whoa.
It looks like the blood pressure is dropping.
Oh,
I don't know what to do.
Turn him to the left.
I know if my baby's lungs are mature enough for the first breath.
Good question. We're going to do an amniocentesis, and we're going to check your amniotic fluid to make sure the LS ratio is 2-to-1. Cord.
Compression.
Variable. Uteroplacental.
Insufficiency.
Late. Head.
Compression.
Early.
All right. So it looks like you might be at risk for an abruption.
Wait. Could it be from all the cabbage I've been eating?
Actually, hypertension is the leading cause of abruption, and your blood pressure is high.
2.5 weeks overdue. All this dry, cracked skin. Anybody have any lotion?
Postpartum depression.
I'm really upset because I had a C-section.
It seems like you're sad that things didn't work out the way you planned.
I had my baby 3 weeks ago. I have no energy, and all I want to do is cry.
First and foremost, we want to ensure your safety. Have you considered harming yourself or your baby?
Michael, you know I love you.
You're doing great, honey.
We planned this pregnancy, and it is wonderful, but at the same time, I just feel so ambivalent.
What you have just witnessed is a normal adaptation to finding out you're pregnant.
The newborn's blood work is back. Which one of these should we be concerned about?
Duck, 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 goose. I ain't no nurse, but that doesn't look right to me.
22 breaths per minute.
Way too slow.
100 breaths per minute.
Way too high.
48 breaths per minute.
Just right.
All right, so it looks like we're gonna have to deliver your baby with a cesarean section.
If we must, but next time in the future, if I want to deliver out of my vagina, will that be okay?
So it will depend on which type of incision you get. If it's a vertical incision, it won't be possible, but if it's transverse, you can try.
Oh, that's good.
Nagel's rule. And then you'll know the due date.
So the doctor has ordered dinoprostrone gel for you.
What's that?
It's going to soften and ripen your cervix like a nice, juicy piece of fruit. That's right, I said fruit.
If a mother has an active case of rubella, both she and the baby will need isolation.
So I'm in my second trimester, and I'm having some serious skin issues. My doc said it was to be expected, but this ain't no picnic.
Cloasma.
Straight Gravadero.
Linea nigra.
Cloasma.
Oh my god, I think my water broke.
That looks like a prolapse cord. What should we do?
Easy, easy. I got this, folks.
Is Janice Watts available? I need to get my name in the book.